name is Kahl and I'm 25 years old. Just after my 21st birthday, I started getting some pains and had to start seeing doctors.
My name's Denise and I'm 35. Symptoms for me started probably around the age of 30, maybe just before.
My name is Kayla and I'm 20 years old. I started with symptoms when I was 11, before I even started my period. I started my period when I was 13 and I had my first surgery when I was 11.
My name's Candice Patterson and I'm 31. I was really young, so probably like 14. Feeling my mum would take me to the doctors in the hospital all of the time with really bad cramps where I'd have to stay off school.
My name's Jo, I'm 36 years old. I was in my early teens, around 12 or 13 years old, but nothing stood out to me as unusual at that age because I thought every woman went through the same thing, everyone was the same as me.
My name is Bonnie and I'm almost 27 years old. With the endometriosis, that was only probably the past 6 years. But I've had polycystic ovaries since I was 12. So it started with that and then I got the endo. So about 6 years, almost 7 years.
Endometriosis is a very common disease. 1 in 10 women, actually, in reproductive age, they might have this disease. It happens when the lining of the womb sitting outside the womb itself. And can you imagine that the lining of the womb usually it's hormone sensitive and it's build up and bleed at certain stage. And if the blood actually coming inside from the uterine cavity, it will come to the outside. But when it is inside the woman in the pelvis, near the ovaries, that actually going to cause a bleeding inside, going to cause inflammation, scarring, and also sometimes cyst. And that will cause lots of issues, including pain or fertility to the women.
I suffer from bloating, chronic pain, a lot of intense pains daily.
Pain is obviously a major symptom.
Intense pain.
Pain that isn't normal.
Pain. I have a lot of pain. That's probably the worst. I get tired a lot.
Fatigue.
Fatigue, grinding fatigue.
Fatigue is one of my major symptoms.
Nausea, vomiting, migraines.
A lot of nausea. So I have trouble eating.
Your memory is pretty bad. You kind of get like brain fog.
What symptoms? One of them being memory loss.
I feel that, pain with period is quite common. But my message to the women that if this pain affecting your life, affecting the way you functioning on a daily basis, affecting your relationship, affecting your job, or you can't go to the school as normal, or you can't go to your college or other normal activities, that you need to seek help. Unfortunately, there is actually a long time between women start to suffer from endometriosis and the diagnosis, and which about average 7 years. Our aim actually to reduce that actually significantly to improve women's life.
I would like everyone in the public to be aware of this condition. It's a very common condition. You're probably working next to somebody who has the condition.
A woman who watches this video has painful periods or other symptoms that go along with it. She knows to ask the question.
If you feel like there's something wrong with your body, you'll know yourself. If you're in pain, if things don't add up, go and find treatment.
If you think that you have an issue and you think that something is not normal, don't question it. Just go to your GP. You don't even have to tell them. You just say, can I have a referral for a gynecologist?
Go seek help straight away. Don't let it just sit there because it gets worse and worse and you'll end up in the emergency room like I did on my 17th birthday.
It's your body, you know your body.
And if the doctor turns you away, find a new doctor, keep going back, push for them to look for what's wrong. You don't need to live in pain. There's something that can be done. And just keep pushing to feel better.
Young women need to know that there are support networks out there. You might not feel comfortable going to a doctor, but you might feel comfortable talking to someone in a support group and getting a little bit more information.
Endometriosis affects probably about 176 million women worldwide. It isn't a small disease, it isn't a rare disease. It is manageable and it is treatable, but do your own research, find out what works for you and for your body, because you never know whether you or someone you love will be affected by it.